Hi, and welcome to The Explainer. Today, we're going to talk all about asthma. Whether it's for you or someone you care about, this is your clear guide to getting to grips with it, from the very basics right through to managing it every day. All right, so here's our plan. First up, we'll cover what asthma actually is. Then we'll look at the symptoms and what can set them off. After that, we'll talk about getting a diagnosis, understand the different inhalers, and wrap up with some really practical tips for managing it day to day. Sound bad? Let's get started. Right then, let's kick things off. First things first, what exactly is asthma? What's really going on inside your body when you have it? It's a question loads of people ask, and honestly, the answer is probably more straightforward than you think. Okay, so here's the deal. At its heart, asthma is a long-term thing that affects the little tubes that carry air in and out of your lungs. Imagine those tubes getting a bit sensitive and swollen, inflamed. When that happens, they get narrower, and that's what makes it feel harder to breathe. Okay, so we know the airways can get inflamed, but what does that actually feel like? Let's get into the nitty-gritty of the symptoms, and, just as importantly, the things that can set them off, which we call triggers. Right, these are the four big ones to look out for. First, there's a cough that just won't go away, and it's often a bit worse at night. Then you've got that tight feeling, almost like a band around your chest. Third is that wheezing sound, a sort of whistling noise when you breathe. And finally, just feeling short of breath. Now, the really important thing to remember is you might get just one of these, or all of them, and they can definitely come and go. So what kicks these symptoms off? Well, they're called triggers, and you'll see they're often just everyday things. We're talking about stuff like dust, pollen, or pet fur. It can be smoke or pollution in the air. For some people, it's exercise or even just a blast of cold weather. Basically, anything that can annoy those already sensitive airways. Now, this is something that is so important to know. When we think of an asthma attack, we often think of wheezing, right? But that's not always the case. You can have something called a silent attack. There's no wheezing, but you might see that chest tightness, someone breathing really fast, or even their lips looking a bit blue. This is serious stuff, a proper medical emergency. And this really paints a picture of what it's like, that cough that just keeps going, the chest feeling really tight. It can even get to the point where it's hard to get your words out. And that right there tells you why acting quickly is absolutely everything. Okay, so if some of this is sounding familiar, you might be wondering, well, what's next? How do you actually find out for sure if it's asthma? Let's walk through how a doctor diagnoses it. It's actually a pretty straightforward two-part process. It all starts with a chat. You'll talk to your doctor or nurse about your symptoms, when they happen, that sort of thing. Then, to get a really clear picture, they'll do some lung function tests. One of the most common ones is called spirometry. It sounds complicated, but it's not. You just blow as hard and fast as you can into a machine, and it measures how well your lungs are working. Simple as that. Right, so once you've got that diagnosis, the next step is getting your asthma management toolkit sorted. And the absolute star players in that kit, your inhalers. So there are two main types to get your head around, and the colors really help. First up, you have the blue one. Think of this as your reliever or your rescue inhaler. It's for when you're feeling symptoms right now and need quick relief. Then you've got your preventer inhaler, which is usually brown or red. This one's your daily protector. You use it every day to calm the inflammation and stop the symptoms from even starting. Just to break that down a bit more, you've got your blue reliever with something like salbutamol for fast action. Then your brown preventer, which uses a steroid like beclomitone to control the swelling. And sometimes people have what's called a combination inhaler, which does a bit of both for long-term control. The key thing is that each one has a really specific job. Okay, everyone, listen up, because if you only take one thing away from this, make it this. In an emergency, if you're having an asthma attack and your blue reliever inhaler isn't helping, please do not hesitate. Call 999 immediately. It is so important. All right, so we've covered a lot. But how do you pull all of this together to manage your asthma day in, day out? Let's talk about the practical side of things so you can feel confident and in control. This is where your Asthma Action Plan comes in. Think of it as your personal roadmap for your asthma. You'll make it with your doctor or nurse, and it lays everything out. Your daily medicines, what to do if you start to feel worse, and crucially, what to do in an emergency. It means you know what to do, and so does anyone around you. And here is a little bit of homework for you. But honestly, it's a super simple habit that makes a massive difference. Clean your inhaler once a week. It just stops any gunk from building up, so you know it's going to work properly when you really need it. Just take the metal part out, give the plastic a rinse under the tap, let it air dry, and pop it back together.
Easy. So, are you ready to take control? Because that's really what it all comes down to. Once you have the right information, the right tools, and a plan that you feel confident with, you absolutely can manage your asthma and live life to the full. It doesn't have to hold you back.